A 2009 clinical trial published in the Journal of Clinical Oncology tested a common garden flower against the standard wound care used in hospitals. 254 patients. Gold standard methodology, randomized, controlled, peer-reviewed. The flower won, not by a small margin. The patients treated with the flower healed faster, had less pain, and showed significantly less skin damage than the patients treated with the pharmaceutical product. The flower costs $3 for a packet of seeds at any garden center. The wound care market it outperformed is worth $22 billion per year. The study was published. It was never retracted. It is still sitting in the journal archive right now. Not one wound care company changed a single product. Not because the study was wrong, because a flower that grows itself cannot sustain a $22 billion revenue stream. Subscribe and hit the bell. Hit the bell? This one matters. 2,500 years ago, Egyptian physicians were using this flower on wounds that would not close. They grew it in temple gardens. Not as decoration, as medicine. They called it the flower that keeps the skin alive. That is not a poetic name. That is a job description. The Greeks used it next. A military physician named Dioscorides was traveling with the Roman army across 3 continents, treating wounds in the field. He documented this flower in the most important medical book of the ancient world. His instructions were specific. Crush the petals, apply them directly to the wound. The juice reduces scarring if applied in the first hours. Not a suggestion, a clinical instruction. Written by a man who had treated more wounds than most modern doctors ever will. Roman soldiers carried the dried petals in their field kits, next to their blades, next to their bandages. When a wound got infected and nothing else was available, the petals went on, the wound closed. Roman military records documented this with the same precision they documented troop movements and grain supplies. They did not keep flowers in the kit for luck. They kept them because they worked. This is calendula, the pot marigold, a member of the daisy family. Grows in any soil that drains. Blooms from spring to frost. Self-seeds so aggressively that one plant becomes 200 by the 3rd year. It asks for nothing. And inside those orange and yellow petals is a chemistry so effective that 3,000 years of human medicine validated it, and 1 century of pharmaceutical economics tried to erase it. Fast forward to the Middle Ages. Every monastery in Europe grew calendula. Not in the decorative garden, in the medicine garden. Monks were the doctors for most of the population. They did not have pharmaceutical reps. They had plants. And calendula was the wound plant, the one they reached for when skin was torn, burned, or infected and would not heal. Hildegard of Bingen documented it in the 1100s. John Gerard documented it in 1597. Nicholas Culpeper documented it in 1653, 1,200 years apart. 3 different countries, 3 different centuries. Same plant, same instruction, same result. That is not coincidence. That is 1,000 years of clinical evidence recorded by people who had nothing to sell. Then came the American Civil War. Both sides were unprepared for the scale of what happened. 600,000 men wounded over 4 years. Field hospitals ran out of everything. Chloroform, bandages, antiseptic, morphine. Surgeons operate on kitchen tables in farmhouses with whatever they could find within walking distance. A Confederate surgeon named Francis Porcher was ordered and solved the supply problem. In 1863, he published a book listing every medicinal plant growing in Southern Territory that could replace the pharmaceutical supplies the Union blockade had cut off. Calendula was in it. His instructions for preparing and applying it to wounds matched what Dioscorides had written 1,800 years earlier. Word for word, the same method. Crush, apply, cover, wait. The wounds closed. Union surgeons documented the same thing independently. Different army, same flower, same outcome. The Civil War was the largest unplanned clinical trial of calendula in American history. Tens of thousands of wounds treated across 4 years by surgeons who had no other option. The results were documented in military medical records that still exist in the National Archives. Nobody has compiled them into a modern study. Nobody has funding to. World War I, same story. French and Belgian field hospitals ran out of pharmaceutical wound care faster than factories could produce it. Calendula went back on the wounds. Again, outcomes improved. Again, documented in medical journals of the period. Again. Then something happened that had nothing to do with whether the flower worked. In 1910, Abraham Flexner published a report funded by the Carnegie Foundation and backed by the Rockefeller family. The report evaluated every medical school in America. Flexner was not a doctor. He had never treated a patient. He had never stitched a wound. He had never watched a soldier's leg close because someone crushed petals into the gash when nothing else was left. He was an educator. He walked through 155 medical schools, looked at their laboratories, and decided which ones were real. The ones that taught plant medicine were not real. The ones that taught the new petroleum-derived chemistry were real. Over 150 schools were closed or defunded. The doctors who knew how to use calendula, The ones who had watched it work on wounds their pharmaceutical colleagues could not close retired. No one was trained to replace them. The knowledge did not die violently. It died quietly, one retirement at a time, one unfilled teaching position at a time. One student who never learned the name of the flower because the school that would have taught them no longer existed. Within one generation, calendula was removed from the United States Pharmacopoeia, the official list of medicines that American doctors could prescribe. It was reclassified as a dietary supplement, a product that cannot legally claim to treat or heal anything. A flower that had been official medicine in every country that used it for 3,000 years was downgraded to a category shared with fish oil and vitamin gummies, not because it stopped working, because the definition of medicine had been rewritten by people who had a financial interest in making sure medicine came from a factory. The Rockefeller family had significant investments in petroleum-derived pharmaceuticals. The schools that survived Flexner's report were the ones aligned with that model. The ones that closed were the ones that competed with it. The report did not evaluate patient outcomes. It did not compare survival rates between plant-trained and chemical-trained physicians. It evaluated equipment. It evaluated laboratories. It evaluated alignment with a model that required purchased inputs for every treatment. A flower that grows in a garden is not a purchased input. That was the problem. Now the science. And this is where the story gets hard to argue with. Calendula flowers contain compounds called triterpenoids. Think of them as natural anti-inflammatory agents. When you apply calendula to damaged skin, these compounds reduce the swelling and heat that make wounds worse. Not by shutting down the healing process the way a steroid does, by calming the overreaction. The body still heals. It just stops making the damage worse. The flowers also contain flavonoids. These speed up the production of collagen. Collagen is the protein that closes wounds. More collagen production means the wound closes faster. Faster closure means a smaller scar. This is not theory. This has been measured in cell cultures at research institutions and confirmed in clinical trials on actual patients. Now the studies, 4 of them, in order. 2009, Journal of Clinical Oncology, Pommier and colleagues, 254 breast cancer patients undergoing radiation. One group got the standard pharmaceutical cream. One group got calendula cream. The calendula group healed faster, less pain, less acute dermatitis. The authors wrote that calendula was superior, their word, superior. Published in one of the most respected medical journals on the planet. 2013, Journal of Wound Care, diabetic patients with chronic wounds. These are the hardest wounds in medicine. Calendula group healed faster. Infection rates dropped. Published, peer-reviewed. The wound care industry changed nothing. 2016, Indian Journal of Pharmaceutical Sciences, surgical incision healing. Calendula gel tested against standard antibiotic ointment. Calendula group had less scarring and faster closure. The antibacterial activity was confirmed at concentrations you can achieve by applying the plant preparation directly. 2019, Wound Repair and Regeneration, Systematic Review. Every published clinical study on calendula, wound healing from 1990 to 2019. Multiple countries. Multiple wound types. Conclusion. Calendula demonstrates clinically significant wound healing activity across burns, surgical wounds, radiation damage, and chronic ulcers. 4 studies, 2 systematic reviews, 29 years of evidence, published in the same databases that wound care companies use every single day to develop their products. And the wound care market has not changed one product. Here's why. Smith and Nephew, $5.5 billion per year. Molnica, $2 billion. Coloplast, $2.5 billion. 3M Wound Care Division, Convatec. These companies sell the dressings, gels, foams, and ointments that every hospital in America uses on every wound every day. The products are locked into hospital purchasing agreements. They are covered by insurance. They sit in supply cabinets on every floor of every hospital in the country. A calendula preparation cannot enter that system. Not because it does not work, because the system was not built for products that cost $3 and grow themselves. Hospital procurement runs on standardized manufacturing, regulatory documentation, liability insurance, and commercial contracts. Calendula has the clinical evidence. It does not have the profit margin. No company will spend millions navigating the regulatory pathway for a product that competes with its own revenue stream at a fraction of the price. So the evidence stays in the journal. The hospitals keep buying the products that lost the clinical trial, and the flower keeps growing in gardens 3 blocks away. But here is the part that should make you angry. Open the ingredient list on any premium skincare product in your bathroom. L'Occitane, Weleda, Burt's Bees, La Roche-Posay, Kiehl's. Look for the Latin name. Calendula officinalis. It is there. In the first 10 ingredients, sometimes the first 5. These companies know exactly what the flower does. Their research read the same journals. Their formulators attend the same conferences. They know about the 2+9 trial. They know about the fibroblast stimulation. They know about the anti-inflammatory pathway. They know everything. So what do? They extract the active compounds from the flower. They standardize the extraction to a precise concentration. They put it in a tube with a branded label, and they sell it for $25 to $80. The flower they extract it from costs $3 to grow. One plant, one season. Enough petals to make a preparation that lasts an entire year. The branded tube lasts 3 weeks. Then you buy another one, and another, and another. That is the business model. Take a renewable resource that costs nothing after the first planting, process it just enough to justify a label. Sell it at a markup that would make the Arab spice traders from the ginger story shake their heads in admiration. Same compound, same mechanism, same flower, different price. The only difference between what grows in your garden and what sits on the shelf at Sephora is the word on the label and the zero at the end of the price. The skincare industry generates $180 billion per year globally. A significant percentage of their most clinically validated active ingredients come from plants that grow freely in household gardens. Calendula is not the only one, but it is the most thoroughly studied and the most aggressively marked up. Because a study published in the Journal of Clinical Oncology is the kind of clinical validation that skincare brands spend millions trying to generate for their synthetic ingredients. Calendula has it for free. The industry uses that validation to sell the extract. They do not use it to tell you that you could make the same thing in your kitchen for $7. You can grow calendula anywhere with 90 frost-free days. In a pot, on a balcony, in a raised bed, in a crack in the driveway if the soil drains. Scatter the seeds on the surface. Do not bury them. They need light to germinate. Water once. Walk away. Seedlings appear in 2 weeks. Flowers appear in 60 days. The plant blooms until frost kills it. Then the seeds it dropped germinate next spring, and the whole thing starts over without you doing anything. Harvest the flowers when they are fully open. Mid-morning is best, after the dew dries, but before the afternoon heat. Lay them on a cloth in a shaded spot with airflow. 2 weeks. They are dry when they snap instead of bending. Fill a glass jar with the dried flowers. Pour olive oil over them until they are completely covered. Put the jar in a sunny window. Shake it once a day. In 4 weeks, the oil turns deep golden orange. Strain it through cheesecloth. Squeeze every last drop out of the petals. Store in a dark glass bottle. That oil is the same preparation that Roman soldiers carried, that Confederate surgeons used on battlefields, that outperformed hospital-grade wound care in a 2009 clinical trial published in the Journal of Clinical Oncology. If you want a solid salve instead of oil, melt a thumb-sized piece of beeswax into a cup of the strained oil. Pour it into a small tin. It hardens at room temperature, no refrigeration needed. Lasts over a year. Total cost? $3 for seed, $4 for oil and beeswax, $7. One time. The plant returns every spring. The supply never ends. The wound care industry sells what this flower produces for free. They know. The clinical trials are in the same journals their research read every morning. The flower has not changed since Egyptian physicians grew it for remesses. The chemistry has not changed. The outcomes have not changed. The only thing that changed was that in 1910, a man who had never treated a patient decided that plant medicine was not real medicine. And a $22 billion industry grew in the space that decision created. The flower did not stop growing. It did not stop working. It did not wait for approval. It did not file an application with the FDA. It did not hire a lobbyist. It did not negotiate a formulary agreement. It bloomed the next spring, and the one after that, and the one after that, through every decade of pharmaceutical consolidation, through every merger that made the wound care companies larger, through every price increase that made their products more expensive, through every clinical trial that proved the flower worked better. It kept blooming, orange and yellow, in monastery gardens that became public parks, in cottage gardens that became suburban yards, in abandoned lots where nobody planted it, but the wind carried the seeds anyway. The Roman military trusted it enough to carry it into battle. The Journal of Clinical Oncology trusted it enough to publish the evidence. $22 billion of annual revenue depends on you not trusting it enough to plant it. The gap between those two facts is not science. The science is settled. The gap is economics. And economics only wins as long as you keep buying the bottle instead of planting the seed. $3, one packet. 60 days to first bloom, self-seeding every year after that. A lifetime supply of the compound that outperformed hospital-grade wound care in a controlled trial published in one of the most respected medical journals in the world. The flower closes the gap for $3 a packet. Subscribe. Hit the bell. The next story opens soon.